Welcome, everybody, and thank you for attending this live. I've been patiently awaiting to speak with Dr. Dijkman again. He has yet another publication talking about breast implants, silicone, and in my world, he is really investigating the migratory patterns and what's happening with this free silicone in our body. And so for you to follow along, we will post the recent publication in this news feed, whether it's YouTube, Facebook, or Instagram. And you can also find it on the Breast Implant Health Summit.com's resource tab. And the newest publication is Exposure to Silicone Breast Implant Infused Media is Detrimental to, I'm going to say C. elegans, because I cannot pronounce that first name. And Dr. Dijkman, thank you again for joining us. And I have many questions, but I'd like to also introduce Robin Tout. And she's obviously, I think most people know her from GPAC and just her advocacy work for over 5 years, right, Robin?
Almost six.
And my partner in crime, Terry Diaz, with All Things Breast Implant Health Summit, and also GPAC. And she's been—
Good morning, everyone.
For over 7 years.
7 years, yeah.
Yeah. So let's dive in. And Dr. Dijkman, you've been at this for quite a while too, because I think my first paper reading of you was with Dr. Capels and the autopsy and the pathology on silicone breast implants from there. So
yeah. First of all, everyone, good morning, and thanks for having me and inviting me. And I'm very thankful that we can together discuss this new interesting topic, I think. And indeed, in 2016, we published an autopsy. There we really proved that silicone was migrating through the body and could really reach every spot in the body. So also the spinal cord, also the brains. But of course, before 2016, we had no money and no time. So we did everything in our own time. And for me, I was a specialist in cell tissue pathology and nanotechnology, but I was not really a specialist in silicone toxicity. So, and there was not so much information in our institute. So I first had to really set up a 3-phase technique and do a lot of controls. And then, in 2010, I really knew that there was something wrong. And then, of course, we had the whole discussion about fluid silicone, cohesive silicone, and that publication in 2016, that was an autopsy. But the critics, they said, yeah, but this patient were also implants who were fluid. And we knew already that fluid implants would migrate. So there we had the question really, and that I did a lot of stuff with mama pathologist Peter Bult. He's a colleague of mine in the Radboud UMC, and I do a lot of work with him. And then we said we have to publish something about a lot of patients and compare the old ones, the silicone fluid ones, and the new cohesive ones. And that we did in the JAMA article. And of course, also there is a bias, and there was also a lot of criticism. But the only topic, what we wanted to prove is cohesive gel, cohesive implants do exactly the same as the old ones, the old silicone fluid ones. And only maybe a little bit slower, but the rest is exactly the same. So, and some people said, yeah, but that were all patients with ruptures, etc., etc. No, we knew also that there are a lot of patients who had the implants for a month or a half year. So, and there we already saw migration. So that was our real statement in JAMA. And then, of course, yeah, we wanted to know, we knew already that silicone is not inert and that it does a lot of things. So maybe later on we can also talk about Asia. Then I think that's not the right word for this huge problem. So silicone toxicity covers much better what is going on there. But we really wanted to prove, is silicone really toxic for the metabolism? Yeah, and of course we see a lot of things in humans and in the human body, but to prove that the silicon content is really toxic, that's a huge job. And there are already some publications about PDMS or D4 or D6 on cell culture, on the cells, etc. Also some work now on organoids, but that are all solitary cells or some cells together, but never in a real environment such as the human body. And so we were looking for an animal, and then we thought C. elegans, that is a real great toxic or a great model to measure toxic responses. And that's why we used it. Then C. elegans has so much homologs with humans, mice, Drosophila, and other species. So the C. elegans is a real nice experiment. And then we thought, what can we give to those worms? Then we know that those worms can live in a medium. And there we can measure them, and we can also see what's going on there. So for reproduction, we can do all measurements. And so when we discussed that, we thought in a silicone implant, there is so much. There is not only PDMS, but there are also a lot of other compounds and a lot of degradation products, but also a lot of metals, etc., etc. And all these materials together, they create a sort of extra effect. So we discussed that and we said, why don't we give the whole amount what is in the implant at our worms? And so we diluted it a little bit and we put it in our medium. And so we try to mimic with that gel bleed. And then what we saw is that within 10 days, the worms became sick. They stopped reproducing. They were immobile. They got a lot of stress responses. And so we also thought about a very important gene, and that is DAF16. And we saw also that DAF16 is upregulated and that it becomes a real factor for stress. Now, and there we can talk a little bit more about, of course, but when you get DAF16, then it's the way, the whole system, the whole route towards metastasis or towards mutants, mutations, adaptations, so adaptation, mutation, and at the end, maybe cancer. So I think with this experiment, we have really proved that silicon is not inert and can create a lot of stuff which we see back in our symptoms in our patients. So that was a little bit large introduction, but now you have already a little bit a completed story.
I have a couple of thoughts, questions. What I find interesting is the whole conversation, let's say with the manufacturers or those who are robust believers in implants, that whether it's silicone liquid, whether it's silicone cohesive, whether it's injectable free silicone or gel bleed, at the end of the day, there's silicone molecules that are free in the body. Like it really shouldn't, like I would love to put that particular narrative to sleep, as far as free silicone is free silicone, whether it comes from the shell, whether it comes from the internal contents like the gummy bears and the cohesive gel, or the older ones in the liquid molecules, right? Like free silicone is free silicone. I think you and your colleagues have proven that it can go beyond the breast tissue, beyond where the capsule is, lymph nodes and all of that, regardless if it's due to rupture or gel bleed, right? And now it's so profound that you et al. Are looking at the impact of the free silicone. I've had the pleasure of having patients send their samples, tissue samples, distant from the breast implant site, and they've come back with free silicone, right? And so,
yeah.
and they're usually in these excoriations or these ruptures or these what appear to be bumps, rashes, and cysts on the patient. So we know it does X. And so I digressed a little bit only because I really want, like in my world, it doesn't matter if it's the silicone breast implant. I know we have to sort of narrow what we're testing, but it's not about just the silicone gel filled implants. It's about free silicone in my world. Would you agree?
I totally agree. I totally agree. But the manufacturers, they knew that, of course.
No.
And what they promised the patient is, we have now a new generation breast implants, and that are the cohesive ones, and they
Yeah.
don't leak anymore. Now,
We get
and
a bilayer shell of cross-linking.
yes, and when they cut in the implants, they show that the amount what is in the implant is really a pudding, so a cohesive pudding,
Yeah.
and they say, see, also when you have a rupture, it will stay in the implant or within the capsule, and that was also true for 4 years ago. I had a meeting here in the Netherlands with a lot of professors, etc., and they said, yeah, oh yeah, but when we have a rupture, yeah, that's an intracapsular rupture. There's nothing wrong with it. And there I said, it is not in the capsule. It goes through the capsule. It migrates into the deeper tissue and via the blood vessels to the whole system. And of course, you can also see that in a lot of patients with echo in the lymph nodes. Then they have a snowstorm. And you mentioned already, now in the cooperation with Peter Bult, you show in biopsies that silicon is in the skin or whatever. So it migrates to every spot. And I know, or our group knows, that every implant leaks or bleeds from day one.
Yeah.
And so it will increase in time. And it is very, very important which patient you have. Then there is always a doses response. So
Yeah.
the sensitivity of the patient and how much can you have. So how much leaks. So that we call the doses response. And yeah, another thing is when you have a new implant, we can tear it up to a meter or we can drive over it with a car. Nothing happens. But when you put it in the body, there will be a capsule. And in that capsule, there are a lot of fibroblasts, but also macrophages. And these macrophages, they produce enzymes and radicals, and they try to disrupt the implant. And they want to protect the body against that implant. And that is a capsule formation. And in that capsule formation, there are a lot of macrophages, and they degrade the implant. So you get biodegradation. And then the cohesive gel becomes fluid again. So a lot of biodegradation products. And the shell, the pores will become bigger. And eventually there is a rupture.
Yeah. But
So,
as the
and
pores
that is the whole thing.
yeah, and as the pores become bigger, more permeability both ways.
Yeah.
And then when
Yeah.
you change the terrain, inflammatory, like all of that, other things, a different cascade can happen in conjunction with, but all because of the breast implant that was placed
Yeah.
there.
Yeah.
Maybe we can come back on another day to talk about the different Baker, the capsule formations, Baker 1 to Baker 4, because there's another conversation going on around there that, oh, we only removed the Baker 4, which in a way may actually be the more robust catcher's mitt than a Baker 1, right? And so for people listening, the Baker 1 is a very thin membranous tissue around the capsule, and a Baker 4 is pretty constricted and pretty tight around the capsule. I think Dr. DeRosa and Dr. Chan and probably Dr. Brenner and Dr. Rankin all have videos online of some of their explants, probably more, and I apologize if I missed some of the names, but you could see the different Baker stages of these capsules. And what is hard is to probably remove, I would think as a surgeon, the Baker 1, because it's thinner, it's more adhered to the tissue, and harder to just peel
Yeah,
away.
that's true. And we just published a publication about that in PRS, that really the Baker 4 capsules, that those increased when there is more silicon migration. So it's really, really important when you want to let patients recover after explantation. Those capsules, especially the thicker capsules, must be removed, and they will never dissolve in time. I have 2 patients who have capsules of 20 and 25 years old, and they are still in the body, still intact,
Yeah.
and still have the silicon and inflammation in it. So you can't really recover when you still let those capsules in the body.
Yeah, and so real quick, once you have that inflammatory response to that non-human particle like silicone or what have you, and this can bring us to the Asia conversation as well and the different adjuvants, but if you have a trigger left in your body, whether that's capsule, silicone, what have you, one can have the propensity to protect, the immune system's going to protect you from that wherever it may be. In my example, for myself, I had a seroma that I had a full capsulectomy. I think my capsules were probably a 1 because they were only in for like a year and a half. And on the seroma removal, they removed the shell of it, and there was silicone within that shell. So if all was removed, then the silicone got past the capsule and it still remains. And then my body mounts a response to that silicone, or to it could just be the cauterized tissue or what have you. And I created another seroma, what have you. So, but I had reaction to it. I had symptoms until that was removed, and I didn't even know it was present. And then there's other women who I see, and thanks to Florrie's work too, we'll do an MRI. They've had a total capsulectomy, even en bloc, but they have scar tissue, bilateral scar tissue in the chest, and we don't know, is that protecting you from the silicone? Is this just regular scar tissue from the surgery? But like, I think it's a response to potentially the silicone that remains behind. And that doesn't mean they didn't do a full capsulectomy, right? So like, there's so much more to, sorry, I got a little excited. There's so much more to study.
Yeah,
well,
I know. Yeah.
It's important to point out too, that these cancers that the FDA is, alerting the public to are developing in those capsules with that silicone. So, and it's very concerning, especially the most recent FDA announcement about the squamous cell carcinoma. The average onset of that cancer is 22 years. So I mean, it's scary to think that we might just be seeing the beginning of these cancers just blossoming because they've been in the patients long enough now to develop those cancers
and gone unchecked. Right?
Yeah.
The statement for the FDA just came out. Let's louder about doing an MRI, and
but I'm really happy with the remark of Robin. Then that is true. Then when I discuss with a lot of plastic surgeons, and I had a discussion last week with plastic surgeons of the Radboud UMC, they often say, yeah, but in the capsule, they are quite normal. There's nothing going on. And then I say, how do you know that?
right.
You don't, then they throw them away. They don't investigate them. And when they really would investigate those capsules, they would see that there is a lot of things going on, a lot of chronic inflammation. And that is exactly the point of Robin. And together with this article, the exposure of silicone breast infused media in C. elegans, the circle is now completed. Then when you have a lot of silicon migration and you trigger cells in the environment, these cells, they become stressed. And when they become stressed, they will adapt. And when they adapt and they still are stressed, they will become mutagenic. And so we come to the squamous carcinoma or lymphoma. So it's very typical. And then, of course, a lot of people say, yeah, but only a few percent. Yeah.
We're not looking.
The problem is, yeah, exactly. exactly.
Oh, and if you
And that
think
is
of-
exactly with smoking, eh? Exactly the same doses response curve. Some people are very sensitive. They only smoke 1 or 2 cigarettes and they get cancer. But we know that nicotine is very bad for your health. We know now that silicone is toxic.
yeah, yeah,
The
And-
FDA even knows, right? They banned injectable silicone in 2017.
yeah,
So because it's dangerous and migrated silicone in the body is dangerous, can cause all these health problems, including stroke and death. Yet the breast
and free
implant,
silicone is free silicone.
yeah,
That's my, I'm a Geiger counter for mixed messages, and I don't get it. Like, and so when they argue your paper, oh, well, that's the old type of silicone implant, and those were liquid versus the gel or whatever. Like, if you look at the constituents or the consistency, I forget the word, but within it, it's all the same letters and numbers, right? Like, it
Yeah.
really hasn't changed much,
Yeah.
except for
And some say also, yeah, but the real problems, that's only when you have a rupture. But that's
No.
why we published Frontiers, together with Fleury.
Yeah,
There we really showed that when you have not a rupture, only gel bleed, the silicone can reach the nerves. And in our patient, the silicone was in the nerves because she was immobile in her hand.
yeah.
And in Brazil, they took a biopsy from the nerves. We will never do that in the Netherlands, but in Brazil, that would be possible. And so we could really prove that there was silicone in the nerves. So yeah, silicone leaks from day one and it migrates into the body, and it depends on your sensitivity and on your immune system if you get a lot of symptoms or really get sick.
Yeah.
And it doesn't matter which type of breast implant, whether it's a saline implant or textured implant or smooth implant, they all do the same.
That's a total different story. Then of course silicone is toxic, but we have 3 groups, and one group is the saline implant. I'm convinced that, and I work together with another plastic surgeon in Belgium, that he has a database of 8,000 patients. When the saline implant is not bigger than 300 milliliters, so not too big, and it is really smooth, then there are lesser symptoms. But when you have an implant with textured, that is a total different story. Then texture gives much more stress to the environment and to cells. So that is also the problem with the biocell of elegans. They are really stressful. They have a high texture, so it's very bad for your cells. But then also a lot of leakage of silicon. So then you have already 2 bad compounds, and texture and silicon. So there is a huge difference when you talk about texture, when you talk about silicon, and when you talk about saline. But when a patient is already triggered by silicon implants and they are removed and replaced by, for instance, physiological salt, so salt implants, then of course the shell is of silicon, so we will get another response.
Yeah.
So there are differences.
And so in my clinical experience, we had a subset of people who only had saline ever. And at that time, we didn't really break them up. Most of them were smooth. And I think we had 2 that were textured, and they all had on MRI after, I think that the youngest implant was 7 years in. And then the oldest was like 12. They all had silicone-induced granulomas, as read by Dr. Fleury. So I think that saline, maybe, I think I heard Dr. McGuire say it was 1/100th of the amount of silicone, because the gel is, or the fill is saline, not silicone. But I think the impact, depending on your stress response, is the same. So I don't think it's necessarily safer. The impact of that shell and that silicone is still an impact, and I think we should
I
quantify
know.
it.
And then I have investigated the different capsules also after salt implants, and all these capsules contain silicon. So that's
Yeah.
true. It's totally true, but it's lesser worse. I would say it's lesser worse.
Oh, I'm gonna
Or
arm wrestle you
maybe
there.
like a slower onset of symptoms because of a little bit less silicone. But again, going back to the cancers, 5 years ago, ALCL was the big talk about the breast implant related cancers. And, I have heard a lot of patients tell me that they heard from their plastic surgeons, oh, you don't have to worry about those. We took those ones off the market that are causing cancer, referring to the Allergan BioCell. However, the SCC, the squamous cell carcinoma that the FDA is talking about, has been found in all breast implants, saline, silicone, textured, smooth, and I don't want to focus only on that, but the scary thing about the SCC cancer is it doesn't respond to chemotherapy or radiation.
No, I totally agree. I totally agree.
Half the patients are dead within 6 months.
Yeah.
That's frightening. And to know that we're only just going to be beginning to see these cancers, I really feel like it's going to explode. So
Yeah.
we have to get ahead of it.
And then there's other lymphomas that haven't been detected
Or
or
talked
you know,
about so much.
talked, yeah.
Yeah.
Totally agree.
Um,
Totally agree.
and
Yeah.
I mean, and maybe you can
And
help.
now they have the new Motiva.
Mm,
That's the 6th generation implant. So that they have published in Nature Biomedical Engineering the surface topography of silicon implants,
mhm.
and there they really said that the Motiva with silk that was so great, but it's exactly the same story. And now already a lot of patients come back with a lot of symptoms and leakage, etc., etc. There is no silicon implant at this moment who is really safe, and they all leak.
Yeah.
So
Oh,
when you get symptoms, go to a doctor, explant, and now even better, stay natural. Then you are
right.
just beautiful as the way you are.
Love that.
Totally agree.
Wise words.
Yeah, it's what's interesting, and I wasn't going to go there. You look at the 2006 SSEDs, right? What the companies used to say, hey, boom, our implants do this, right?
Yeah.
And they talk about gel bleed, and they tested it at body temperature for 90 days in a bovine or a serum type method, and then they measured the liquid, the serum, to say, oh yeah, all these things come out of the shell in a volatile form or an extractable form. So they know X happens at 37 degrees Celsius for 90 days. And now, and then in 2021, you have something called there's a company called ECRI that the FDA worked with to look at the impact of silicone, because they're like, maybe silicone isn't as inert as we once thought. And they increased the risk to a moderate risk for breast implants and the silicone that comes out. We'll just call it free silicone, right? And so you have all this confounding data that really correlates to the company says they give you free silicone. They didn't formally, I don't think they did not aggressively look in 2006 for degradation, transference, integrity, or something called tribology, the friction that happens, especially when you go under the muscle, right? And so we want the companies to do this research, as well as when a tire breaks or when a car crashes, you have an airbag, right? When something happens, and we know yours rupture, we can see that start at 4-year mark, maybe even a little bit earlier. Like, what do we do if it does rupture? What's the safety in place that we do, right? MRI every 2 to 4 years, or like if you know something is leaking, what's the safety for these women and men, right? And transgender, what's the safety mechanism we put in place? All we have right now is the standard of care is explant, but we need more. What do we do if you do have them in? What's your safety? Of course, MRI, but every 2 to 3 years at your expense. And radiologists here in the US, they don't look at breast implant integrity. Like, how do we keep these people safe? And there's not an easy way to filter out silicone.
No.
I mean, you may be of the lucky ones if it's coming through your skin. I'm a little tongue in cheek here, right? At least it's leaving the body. So why aren't we testing the stool and the urine and the sweat of these women? So anyway, sorry. Just, I
Yeah.
think if Motiva is coming to market, they should have all these state-of-the-art testing that we know now and not compared to 2006. That just because they already are reporting that we're better than, well, 2006 was horrible data.
Yeah,
Horrible.
I totally
Acutely and
agree.
chronically. So
Yeah.
don't give me that as a statement. No.
Yeah, but also, Danielle, all those experiments who they are doing, that is all in vitro. So outside the body, inside the body is such a different story, totally different.
And, you know, they never followed, they never fulfilled the FDA requirements for their approval to follow 42,000 patients over 10 years. That, you know, the FDA allowed them to modify their studies to use a lesser amount of patients. So we never had a registry until 2019 in the United States. So conveniently for them, they just lost track of all these patients and, oh, well, we don't know what happened to them. Well, we know what happened to them. There's 200,000 of them in the largest breast implant illness group. They're sick, you know, and the manufacturers just didn't do their due diligence, nor did the FDA in following those patients. Because as we follow them now and we start to retrospectively look at the data and their health, I mean, they literally can just lay out their 10-year health history after getting breast implants. And it's just a constant decline in their health. So we definitely, you know, when we know better, we have to do better. So we would like to see that better work done. But thank you to you and your colleagues for your amazing work, because I really feel like when I go back and read some of the studies in the plastic surgery journals, I recently spoke at the plastic surgery conference for ASPS in October, and I encouraged plastic surgeons, if you really want to know about breast implants and how they impact health, you need to look outside of the plastic surgery journals.
Yeah.
You need to look at studies like yours and Dr. Fleury, Dr. Travert, because those are the studies that are showing the long-term health effects. And I see a lot of the studies in the plastic surgery journals, and their markers are on how aesthetic the implants look. How well are they staying in place? Do they stay in position? Do they fall? Do they droop? Who cares when you're laying in bed 20 hours a day, you know, with 5 autoimmune diseases and your hair falling out? So I think some of the good work that we're doing and bringing awareness to that and encouraging plastic surgeons, there's so many great ones out there now doing fabulous studies because of your work, Henry. And I think we're just going to see it come full circle and really realize the truth. And, you know, and then just start looking forward to these women and how we can optimize their health and just get them healthy and to a point of able to live their lives again and do the things that they want to enjoy doing in their life.
Thank you for your very kind and positive words.
Very much appreciated. So Dr. Dijkman, what's next? That's what I want to know. Like, and how fast can we get the information?
What's next? Now, maybe you know, I had a challenge to have a subpoena against Mentor in the United States, and that works not so well. Then they have a lot of course, intelligent papers and a lot of statements that they are safe and that they did everything all right. And now we wanted to attack Elegans in the Netherlands. And with our group, we were not ready for a good subpoena really to survive. And we had only 3 months left. So now another group with BCW, that's Clara Wichmann, will do the whole thing against Elegans. And so we were too late for that, but I still work on supporting a lot of patients every week, every day. And I try to support them and to give them information and help them to recover. I work now together with a lot of different plastic surgeons, also in the Netherlands, and they also see the problems, but they are a little bit afraid to speak of. So I help them, and together we create help for all those patients. And that, I think, it's the most important thing. And what was my goal the last 10 years is to create awareness. And that is, I think, gone really well. And I thank you, of course, and this whole team for all their support and creating awareness also in the US and in cooperation with the FDA. And hopefully, we can create more awareness and help all those patients. And especially for me, it's very important that patients who have implants, but also I have 2 patients, men with silicone testicles, and they have the same problems. So awareness must be growing, and when there are symptoms, you have to be helped and there must be done something. And what I now see is that a lot of surgeons, but also doctors at home, they don't know, they are not familiar with silicone toxicity. And so together with mama pathologist Peter Bulls from the Radboud UMC, I try to create more awareness for surgeons and doctors.
Yeah, well, thank you.
Yeah, it
so
is
much.
up to us too.
Yeah.
Yeah.
So hopefully we can do something about it.
Well, thank you. Thank you for your time. And we'll, of course, look forward to more publications and have you on again. I just want to check because I'm not looking at the Facebook Live. I know it's early in the US, but I was curious if there were any questions.
I saw lots of comments, but no real questions.
Well, we'll, if it's okay with you, Dr. D, we will tag you if there are questions there, and then we can get them answered and we can help direct and navigate people where they need to go. So
Yeah, that's perfect. No problem.
thank you, Robin, Terry, and Dr. Dijkman. As usual, thank you for yourself and your work, and have a pleasant day.